Hi, I'm Sharon Chamberlin. I'm the CEO at Northern Nevada Hopes. I'm excited today to show you our clinic and our community space and help you understand a little bit more about what we do right here in downtown Reno to help build a healthier community. First, I'd like to show you our beautiful community space. Our community space was something that we built very intentionally because we understand the importance of having a sense of community for our patients and a place for them to come and belong and be able to attend meetings and other things. So for the community center, literally everything is available to the general public. So we have everything from AA meetings to NA meetings, foundation boards that come and share this space on a regular basis. We also use the meeting rooms internally for telehealth for our patients, and so when we have a nutrition class or something like that going on, we can have our nutritionist sitting in the community room and being able to share her screen and have our members and patients being able to access these services through telehealth. Next, I'd like to show you our case management services. Case management, we know, is an integral part of our comprehensive services because healthcare is so much more than just your physical health and your behavioral health. Having case management right here on site really helps our patients have access to everything from all their other needs, such as food and transportation and housing and access to other services in the community. Behavioral health is a huge part of what we do right here at Hopes. We have everything from psychiatry for adults and children, and then we have behavioral health therapy for adults and children, including play therapy for the kids. We also have substance use treatment. This is such a big part of what we do here at Hopes because we recognize it's a very holistic piece and journey of health, and you have to have your behavioral health in line and if you're going to be physically healthy also. So this is our second floor of our clinic, really the heart of our clinic, where all of our medical care happens. We serve people from birth to death, all ages, and we welcome anyone, whether they have insurance or have any other ability to pay. We will help you regardless of your ability to pay. Right here we have the pediatric clinic, and the pediatric clinic sees 0 to 18. One of the things that's super unique in each of these pods where we see individuals is that there's a center pod that allows us to have integration services down in the clinic. So we don't just have our providers down in the clinic with our medical assistants and RNs, we also have behavioral health and case management services right there so that when individuals come in and they speak about something that they might need a different service outside of their diabetes or their hypertension, we can pull a case manager or a behavioral health therapist right into the clinic room while they're here and get all of their needs met at once. When we go further down, we have the adult pod, which is set up just like the pediatric pod, and then we have the third pod on the second floor is really some of our auxiliary services. So it's everything from our HIV and hepatitis care clinic, our LGBT clinic, and also has X-ray and our lab services all right there. Also on the second floor, we have our medication-assisted treatment program as well as our X-ray and our lab and some other services. It's so important for our population that often struggles with transportation or taking time off from work or any of the child care, any of those other things, to be able to get all of their services done on the day that they come in for their clinic appointment. So if they come in to get their hypertension checked, they can also get their lab work, and if they need to get an X-ray, they can get their X-ray. They can go upstairs and see a case manager, they can see a behavioral health therapist. Everything can happen in one site, in one place for the benefit of our patients. Well, welcome to ChangePoint. ChangePoint is one of our most unique programs here on our Hopes campus. ChangePoint offers syringe services programs to injection drug users as well as free HIV and hepatitis C testing. In addition to that, we have an STI clinic and a PrEP clinic for HIV prevention. These are very important components in our community to be able to offer because they help prevent the spread of HIV and hepatitis C among very high-risk populations. So we're grateful to be able to offer these services right here on Hopes campus. Hope Springs is our community bridge housing project. At Hope Springs, there are 30 individual units of 96 square feet each, in addition to a large community center where our residents will be able to get services such as case management, behavioral health, and even things that include psychiatry, substance abuse treatment, and physical health wellness checks right there on site so that they don't have to leave the actual campus to be able to access those services. Our target population for the project is chronically homeless individuals with severe mental illness. So these are folks that have often been on the streets in our community and maybe that you've seen day in and day out. They will have a place to go and stay and be able to access all of these services in a very welcoming environment and be able to heal and overcome and grow. Individuals that come can also bring their pets. We have 6 units that will allow dogs. A lot of folks that come in have their pets and they don't have anywhere they can go and bring their pet with them when they first come inside. So important for individuals to have that support system, so we'll have it available at Hope Springs. Our pharmacy here at Hope's is state-of-the-art, and that's thanks to a lot of local foundations and donors. We have a robot in the pharmacy. We also have a bubble packer for individuals that have multiple medications that they need to take within a day, maybe at different times of the day, to ensure that they know what they should be taking at any given time. In addition to that, we offer delivery of our pharmacy, so we take to work, we take to your home, whatever's convenient for the patient to ensure that they can stay on their medications. It's really important for us to have a pharmacy right here on site because this allows us to be able to have people go upstairs, see their provider, get their prescription, come downstairs and pick up their medications all without leaving the building. It makes sure that people are adherent to their medications and we have much better health outcomes that way. With COVID, we want to ensure that our patients are safe. So when they come on site, they are screened right downstairs in the lobby. And if they have any symptoms, we ask them to go wait in the parking lot and they receive a parking lot visit. So they actually get seen by a provider outside in one of our tents in the parking lot. If they don't have any symptoms, they are cleared and they're able to go upstairs to have their appointment upstairs. Either way, people are able to be able to be seen. We also have COVID testing available for patients. This allows us to ensure that individuals that are having symptoms are able to get tested so that we're aware of what their status is and we can get them the help that they need. Thank you for joining us on our tour today of Northern Nevada Hopes. We couldn't do this work without the generous help of donors just like you. Thank you for helping us to build a healthier community. Learn more at nnhopes.org.